Professional Climate Lobby Day on October 31st. When we get there, I urge you to go online and endorse this prescription for action and tell your colleagues. I don't think there are probably any professionals in this country who would not agree with these points. And if we did them all on a federal level, we would be able to cut our emissions in half by 2030, which is what we need in order to be on track for a sustainable future. So I hope that you will all do that. It takes about a minute to go to that website and do that. And why can't you do it later? Because really the window of opportunity is closing. We are about 80% locked into a fossil fuel source of energy. If we're going to make a turn, we have to make it now. The longer we wait, the higher the resulting temperatures that we're going to see. This is a very busy slide. I like this one better. It says the same thing. So we have to make that turn now. So thank you all for sticking it out with me. I'm really sorry that I was late. And all of this slides and notes for this presentation, another one that I have for the general public, one that's in Spanish, one that's a 20-minute one that I use with Rotary, are online at our website for you to use. Nothing would make me happier than to hear that someone else had done one of these presentations. They're really, you know, my goal is to raise the health professionals' voice because we are really needed. So I'm happy to answer any questions that you have. Or hear any thoughts or comments?
Do we have to have a costume for the rally on the 31st?
No, you don't.
Oh.
But and you know, it would be great if you can't come to DC. If something happened at legislators' district offices here. Yeah. So I will be there representing you.
Good.
If you do an endorsement, I will go and represent you. But there are doctors and nurses from Physicians for Social Responsibility chapters on the East Coast and Nurses for a Healthy Environment who will be there with me delivering these prescriptions. So they're going to have the legislator's name as the patient, and then the prescription, and then the health professional's name as the prescriber. So it should be fun, and we really want to make the point with them that this is about health, it's not about ideology, and we expect them to act.
The American Public Health Association is having your annual meeting.
I know, that's why we set that date, because we're hoping that we can persuade some of those folks to come early and come to DC before they go. And we are, folks in the DC area are going to be putting people up, so we're going to try and make it as inexpensive as we can, but we really want that. If you have people that you know are going, talk to them about it.
Are you familiar with the Citizens Climate Lobby?
I am very.
And what do you think of that?
I think they're wonderful. And this is the second time that I've been across the country doing this. I did the same thing last summer on a different route. And Citizens Climate Lobby invited me to go to DC and do briefings of congressional staff. And what they did, they're building relationships with Republicans. And they had me go in and do presentations about climate and health for, I did 3 sessions with about 5 people in each one. So I talked to 15 different congressional offices. So they are pretty amazing. They're helping us. They're doing the training. They're going to train us to do this lobbying and support us in it. So we're trying to pick up some of their techniques and use their support so that we can be as effective as they are. But I think that because we are health people, we need to have this broader platform, and we need to talk about active transportation and nutrition because of who we are, and because there's not one thing. If we don't do conservation things, we can't probably generate enough alternative energy to replace all of the fossil fuel energy that we're using now. So conservation has to be a big part.
Did you fear for your safety riding a bike in Omaha?
No.
That's good. That's good because you probably saw the stenciled bike routes in some of the major streets.
Someone gave me a map.
Oh,
bike
good.
map.
Good. Okay.
Bike route map.
Good.
But you know, I mean, there have been a couple times on this trip where we started down roads that really I thought you know, could be suicidal, and we just
Sure.
turned around and found another way.
There you go. Well,
Yeah.
the whole bike piece is part of the Douglas County Health Department got a multi-million-dollar grant several years ago, and it's part of the Livable Omaha. And so the community grocery stores, the bike pass, the alternative transportation, the access to exercise, et cetera, is all part of, it's called Live Well Omaha.
Wonderful.
So, but I want to talk to you personally, if you have a minute.
Yeah, sure.
If you'd like to sit down. Okay, so I teach in the Masters in Public Health program online at Creighton University, and I'm a nurse by profession. And I have about three things I'd like to ask you. The slides, I'm going to be teaching actually starting October 22nd the environmental health course. Because that's been my passion.
Great.
And so a lot of this I'm familiar with.
Yeah.
So I would like to expose my students to
Yeah.
some of this information.
Please do.
Okay, so is
If you
it
go to the
like a
website,
public- okay.
it's at climate911.org, and there's a thing on the menu that says slideshows, and you can go there and just download what you
Okay.
want.
Oh, great.
Yeah.
Okay. And lastly, our son is one of the lead investigators in the Solar Valley Fever in California. And he just came back from the CDC in Atlanta this past week presenting to people in Atlanta about Solar Valley Fever. And he's in the California Department of Health and Nutrition.
Oh,
And so
So he probably knows
I
some
would
things
like
that would
to,
help
right?
me, yeah.
Right, well, and he would, I'm sure be a mutually beneficial contact. So how could I tell my son to?
Oh.
I know you're on the road, but.
I have cards. I
Okay,
have lots
great.
of cards.
Oh, excellent.
And I'd like to give them
Excellent.
out because I'm carrying them all.
Oh, please.
So I'll give you a bunch of them and
Oh,
give them
please
to your
do. I
colleagues. How
will.
many do you want?
That's fine.
Is that enough?
Oh, you know.
Yeah, give them to everybody that you know.
This is very
Tell them to go
important.
do online
Okay.
and do that endorsement. It only takes
So-
a minute. It's real simple.
Well, I would.
How many do you
Oh,
want?
just need one.
Just one. Okay. I'll use Amazon. Yeah. Have some cards.
So if you want to do one, I'll help you do a presentation.
Sure, absolutely.
Yeah, and there really is, the speaker's notes are on there.
Okay, great.
So that's, and there's also a list of references,
Okay.
so that you can go back and look at where I got that information, and, you know, so
Right.
that you can feel solidly
You can
comfortable that it's,
translate
well,
it to layman's terms too, I think that would be.
yeah, and well, the other talk that I have is a layperson's talk, and it works really well. People get it, and I spend some time talking about public health solutions like I do here, and that we can't, that personal consumer choices are not going to make it.
I actually been up to Alberta and saw the tar sands place. We did an evening walk up there.
Thank
They
you
gave me
so much.
the little mask, you know, to wear. I definitely will. And I think it's a chance.
I just want to say thank you. Oh, okay, great.
Yes, thank you very much.
Yeah.
Oh, this was excellent.
Well, you're welcome. I'm sorry that
Screwed up. I'm sorry for the people that have.
If anybody knows how to fix that, I would really welcome the help, because the calendar is like, the times just keep changing on.
Yeah, oh.
And it's on
in
our
terms of that,
website, and people
exactly.
keep sending me emails and saying, is it at this time, or is it at that time? And I
Oh.
keep fixing it, and it keeps going back, and
Wow.
now it got me, so.
So did you say that this presentation is also online?
This presentation is online, it's at our website, it's downloadable.
Okay.
And so is one for the general public. There's a set of slides in Spanish that does not have speaker's notes with it, because I'm one of these people, I learned Spanish by doing farm work, and so I'm sort of a little illiterate.
Because I would love
yeah.
to share with the people who came this afternoon.
Yeah,
Like,
please do.
That's what I was.
Please do.
Right, right.
Please do. I'm just bummed that I did that.
No, but we're very thankful
Yeah.
for your efforts in doing the whole bike ride as a way of showing, highlighting transportation issues, and also coming and talking to us today, and we really love having you on campus.
Absolutely.
Yeah, I just wish I had been here an hour earlier.
Yeah,
Oh.
I mean, the good
But
news
you had a
is
great crowd, didn't
we
you?
had a great crowd.
I needed.
Well, but you can do this again, right? You can do this yourself.
Yeah.
You know, it doesn't need me.
Absolutely.
Now we just have to share it with all the elected officials who are voting
Right.
on more wind next month.
And that was my question was, how do you, when you talk to, or have you talked to politicians, for example, skeptical politicians, that's me.
Neutral.
Well, one thing is to talk about it as, don't even say the C word. Because, for Republican politicians, the consequences of breaking ranks with the party and doing it, even recognizing that climate change exists, the political consequences are something that they're not going to brave. But if you say, no, this is about our epidemic of diabetes and heart disease, and how are we going to pay for all this, and we're looking at a physician shortage of we'll be short 90,000 doctors by 2020. There's no way that we're going to be able to take care of everyone. So really, we could ask for all of this just on the basis of public health and prevention, and not even for certain people. And I think, some of this stuff is low-hanging fruit.
Yeah.
So we should try for that. Maybe they're not going to go for a carbon tax, but they might stop trying to take away the active transportation money. Every year it is a battle because they try to take that funding away. And we're asking for it to go from 1% to 5%. And same thing with the farm subsidies. We really need to be paying farmers who grow vegetables,
Yes.
or people who eat.
Yes.
I mean, it's insane for us to do one thing in one branch of government and then try to say something else in the other. So I think these are the things that we can say. You have to figure out who you're talking to, I guess. And I'm not extremely experienced at that either. But the Citizens Climate Lobby is, and they are going to do a webinar for us about talking to elected officials about climate change's preparation for our lobby day. It's going to be on October 17th. And if you go online and you say that you're interested in lobbying, then Renee Saberi, who's the person coordinating that, will let you know when the webinar is.
I've done some lobbying in Washington DC as part of PSR and Earth Justice.
that would be-
You get representatives of states.
Right.
I've done that
Right.
a couple of times now. But since you mentioned food, I want to ask if you had any dinner plans.
No.
Okay, because Tim has arranged for anyone who's interested to join us for dinner, and there's this a restaurant called Katie's, a Greek
Right.
restaurant, just walking distance from here.
Uh-huh.
So you're welcome to come join us for dinner if you'd like. If you
Is that where you're taking Dr. Ring and
Yeah.
her husband?
Like to.
Yeah,
Katie's?
yeah, no, that'd be great. I would love that.
Okay.
It's just like 2
Right,
blocks.
yeah,
Yeah.
exactly, I know where it is. How soon what are you up to? I was gonna give John advice.
I know that you'll redo this talk. I feel so
like
bad.
Oh, yeah. At the very least, we can share it with everyone.
Yeah.
Okay.
We'll do something too.
Yeah.
This is so important. Oh my God.
It's it's a great tool,
It
and
is.
it's been tested and honed, and it really works.